To get in to see a geneticist, usually people would come via a referral from their paediatrician. So I guess the first step for a family who might have concerns about their child is to make sure that they've got a good paediatrician that they can work with, and to have a discussion with them about their concerns that there could be a genetic condition occurring in their child. In different parts of the country, there are different waiting lists for seeing a geneticist, and there are geneticists who work in public and in private. So it's worth exploring all of those options depending on where you live.
So when someone comes in for a genetics appointment, usually they will meet with a geneticist in the first instance who will ask what sort of questions they have. They'll obviously have the referral in front of them, but it's really important that there's an agreement between what you want to achieve in that appointment that day, and the geneticist needs to know whether they can answer the questions that the family has or to modify their expectations of the consultation, so no one's leaving at the end of the day saying that wasn't what I expected. So setting an agenda for the appointment is really common. Then it might involve gathering family history information, gathering a developmental history for the child, and then doing a physical examination, which is really usually very non-threatening in a genetic setting, so it will be a lot of looking and not so much touching. So looking at faces, looking at hands, feet, backs, getting children to walk, doing their height and weight. So it's a very non-threatening examination. If any testing goes ahead, it will usually be a blood test. It can be a saliva test, which is how the microarray is done. But all of that will be discussed with the family before anything goes ahead on the day.
Occasionally, when a geneticist is seeing a child, there and then in the appointment, they will make a diagnosis. But that would be the exception rather than the rule. More often, they'll have a sense of how likely a genetic condition is, or even maybe a group of conditions that they're considering for that child, but it's unlikely that when you go to your first geneticist appointment that you're going to come away with a diagnosis. The sorts of genetic tests that might be ordered in a child where we think they have an underlying genetic condition include things like a microarray test. We sometimes will do tests of imaging tests to look for any structural abnormalities of kidneys or heart or brain. Sometimes those tests are ordered, so like a brain MRI. We sometimes order photographs, which we use as a way to review the child's story with the rest of our team. And we do that to try and work out what sort of diagnoses should we be considering in this child, how can we get further testing, what further tests should we consider. And of course, exome sequencing is a test that we would consider in many children with a suspected genetic condition.
People will usually receive an appointment letter that suggests they bring in their child's health record, so just the one that details growth and development from birth. Having asked about the family history is really helpful as well. Some people are great at gathering their family history information, and other people have never really asked their parents were their children or other adults who had significant health problems. So it's worthwhile asking those questions before they come in, and that can be helpful.